Hi everybody, we're going to be lecturing today on sinus imaging and anatomy. Okay, so the paranasal sinuses, and you guys should already have learned all this for our last exam, so this should just be review for you, but they're called the paranasal sinuses. There are 4 groups of sinuses. You have your frontal, in your frontal bone, your ethmoid sinuses in your ethmoid bone in the labyrinths, your sphenoid, back, the most posterior of the sinuses in your sphenoid bone, and your maxillary sinuses in your maxillas. Okay, all of these communicate with the nasal cavity. Okay, these are defined as air-filled cavities. They're located in the frontal, ethmoid, and sphenoid bones of the cranium, as well as the maxilla of the face. They're named because of their formation from the nasal mucosa and their continued communication within the nasal fossa. Okay, the functions of the sinuses, they serve as resonating chambers for your voice. They decrease the weight of the skull. They aid in warming and moisturizing inhaled air. They also act as shock absorbers in trauma, kind of like an airbag does in a car, and they possibly help control the immune system. Okay, development of the sinuses begins in fetal life. You are born with your maxillary sinuses already developed enough so that they can be seen on X-ray. By the years 6 to 7, the frontal and the sphenoids are distinguishable on X-ray, and your ethmoid sinuses do not fully develop until 17 to 18 years of age. Okay, the first we'll talk about is the maxillary sinuses. These are the largest of the sinuses, and they are the most symmetric. You have a pair of them, one in each of your maxillofacial bones. They will vary in shape, size, and shape on each side, but like it says, they're mostly symmetrical, and they are usually in a pyramid shape, an upside-down pyramid. Okay, and this is an image of the maxillary sinuses, one in each maxilla, and you can see they are like a pyramid shape, okay? And the apex of your pyramid is posterior and inferior, okay? It will show air fluid levels, and they are located above your teeth, okay? This shows how they communicate in your nasal cavities, okay? Your maxillary sinuses and how they communicate down into the nasal cavities. Okay, the frontal sinuses is the next one we'll talk about. That's the second largest of your sinuses. They usually are in a pair, although some people don't even have any, so it can vary. They're located between the vertical plates of your frontal bone. They can be very, very tiny or very, very large. So they're very different in everyone. Sometimes they are absent, and they are very rarely symmetric on both sides if you do have 2. Okay, and this is just showing the frontal sinuses and where they are located. Okay, and here in the frontal bone on both sides. Okay, and like it says, rarely symmetric. And sometimes the number will vary, and you might not even have a pair. The sphenoid sinuses are normally paired. See, most people think we only have 1, but most people will have 2 sphenoid sinuses. They occupy the body of the sphenoid bone. Often only 1 sinus will develop. You won't have more than 2. They will vary in size and shape. They're usually asymmetrical. And they are located below the sella turcica, and they extend between the dorsum sella and the posterior ethmoids. And this is a picture of where your sphenoid sinuses are located. Now look at this. They may indicate a basal skull fracture. So one of the things we're going to learn today about sinus imaging is you have to use a horizontal ray, and you should always have your patient upright, and that is to show air fluid levels, okay? That's important when we are talking about any kind of trauma fractures where blood might be filling those sinus cavities. And this is showing an illustration showing a person with a pair of sphenoid sinuses and how they can be asymmetrical. Okay, lastly, we'll talk about the ethmoid sinuses, and those are located within the lateral masses of your ethmoid bone in your labyrinths. They're composed of varying number of air cells, usually from 2 to 8, and they're divided into 3 separate main groups: anterior ethmoids, middle ethmoids, and your posterior ethmoids. And this illustrates where those are located. So they are within the lateral masses of your ethmoid bone. There's 3 different collections: anterior, middle, and posterior. And they also communicate with the sphenoid sinus and within your nasal cavity. Okay, and this is another view of the ethmoid bone. So this is your anterior view, and you'll remember this is the cristagalli. This is your perpendicular plate, and these are your labyrinths here. Okay, and these are your air cells within your labyrinths. Those are your ethmoid sinuses. This lateral view shows your anterior section, your middle section, and your posterior section of your ethmoids. So they extend quite a bit back, and you'll see during sinus imaging that on your lateral sinus view, we need to ensure that we get all of these sinuses. So we need to make sure our collimated field includes a little bit beyond this posterior aspect of where the sphenoid sinus would be located, so that we don't clip anything here. Okay, another view of our sinuses. So you've got your frontal sinuses, your ethmoid sinuses, your sphenoids, and your maxillaries. Okay, and here in the lateral view, your frontal, your ethmoids, anterior, middle, and posterior, your sphenoids, and your maxillas. Okay, and this just shows how all of these things communicate. So your ethmoid sinuses are connected to your nasal cavity. So they do communicate here. Your maxillary sinuses as well do communicate with your nasal cavities. Okay, you don't need to go too particular into these processes or these, your infundibulums, anything like that. Don't worry about that. Just remember that these sinus cavities are linked. They do communicate with your nasal cavities. Okay, and this is a CT of that same illustration, and it shows your ethmoid sinuses. These are your naval cavities and how they are connected. Okay, your maxillary sinuses. Okay. Okay, now to get into our essential procedures for our paranasal sinuses. Okay. The first one we're going to talk about is lateral, but we're going to go over 4 different projections. So our lateral projection, our PA axial projection, a Waters, and an SMV. Okay, now we are talking about the technical considerations that you have to remember here is we need to have a good exposure factor, and your book does say 85 kVp for sinus imaging, but we have seen anywhere down to 70 kVp. So as long as you have good contrast between air and fluid, your black and your white, you need good contrast for sinus imaging for them to be diagnostic. So you're going to use your site protocol that's already been tried and true. And for sim purposes, we'll use Merrill's like we always do, 80 kVp, 80 to 85, okay? Your upright position is absolutely necessary to demonstrate fluid levels. Now, you're going to have trauma patients that cannot be upright. In that case, they can be supine or they must be supine, but we're going to make sure we do a horizontal ray with them so that we can still see some type of air fluid level. Ideally, when your patients are presenting with sinuses, though, in the x-ray department, we're going to have them upright, either seated or standing at a bucky. Now, these demonstrations are in your book, but they show a coconut filled with coconut milk. And it shows the difference that can happen to your image when you use a horizontal versus an angled ray. Okay, this is an upright image with a horizontal ray, and it shows a very distinct air fluid level, and that's what we're looking for in sinuses. Okay, this image in the middle here shows an upright coconut, an upright image, but with an angled central ray. And notice how you no longer have a distinct air fluid level. Now you have, it's fuzzy, it's blurred, it is distorted. Okay, we want to stay away from any kind of angle to our central ray when we're doing sinuses to prevent this distortion in between the air and the fluid. Okay, this third image shows a supine image with a perpendicular central ray. So your air fluid levels are gone because they're no longer distinguished because this is not upright imaging. So therefore, it just shows you that it needs to be upright whenever possible. Your central ray is going to remain horizontal, not angled. You should always shield, okay? And then we're going to make sure you properly collimate your images. It's critical to reducing scatter radiation and to prevent excess patient dose. Okay, the technical considerations for sinuses, we were just talking about your kV. We're going to go to 80 to 85 kV. We're going to make sure that we have erect imaging, upright imaging when possible. Horizontal beam always. Okay, use a small focal spot. And you should have learned this in physics and maybe with Rich. Your small focal spot increases detail imaging versus your large focal spot that you use for larger body parts. So we want some detailed images, so we're going to use small focal spots. And your IRs in these pictures need to be free of artifacts. So make sure your IR screens are clean. Like we were talking about during orbit imaging, how important it is not to have any flecks of anything on your screen and to make sure your IRs are cleaned. Okay, we're going to do the same here for sinuses. Okay, the first image that we are going to talk about of the four is our lateral sinus. Okay, it's just basic lateral. It can be to the right or the left. For instance, if your patient is presenting with right-sided sinus pain and there's a sinus series that has been ordered, put the right side of your patient's face up against the IR so that you have more detailed imaging of that right side of the sinus. Same if they present with left-sided sinus pain or a history of sinusitis in the left side, you would put the left side lateral. Okay, make sure you're marking your images appropriately. Okay, for your lateral projection, your central ray is going to enter the patient halfway between the EAM and the outer canthus, okay? And that's going to make sure that our center point, our central ray, is in the middle of our sinuses. And remember, they extend all the way posterior back through that sphenoid and all the way anterior to our maxillaries, okay? Going to make sure your patient is seated erect and make sure they're in a true lateral. So they're going to be in that anterior oblique position up against that vertical bucky. The mid-sagittal plane of the head is going to be parallel to your IR plane. Your IPL, your interpupillary line, is going to be perpendicular to the IR plane. And then lastly, your infraorbital plane. And we're going to show this to you. So your infraorbital plane right here to your IOML, to your EAM, that IOML line, is going to be perpendicular to the front edge of your IR. Okay, and this shows it a little better. So your infraorbital line, your IOML going to your EAM, is going to present perpendicular to the front edge of this IR. Okay, and that's important to keep all of your lines straight. So you want your IPL perpendicular, your IOML perpendicular to this front edge, okay, and your MSP is going to be parallel. Now your central ray is going to enter, it's going to be horizontal, no angle at all, okay, and it's going to enter 1/2 to 1 inch posterior to that outer canthus. And that should still be from this outer edge to your EAM, the halfway point. Okay, and that's going to ensure that you get all of the anterior and posterior portion of your sinuses. Okay, you're going to make sure that your IR is centered to your CR placement, and our collimation is going to be approximately 8 by 10. Okay, we're going to make sure that we get a 1/2 inch to 1 inch in front, anterior to the tip of the nose. Going to make sure that we include all of the occlusal plane, and that's where the top of your teeth, your top teeth, that plane where they hit the bottom teeth, we're going to make sure that we get all of that. Okay, posterior back to the ear auricle. Okay, and then we're going to make sure that we have 3 inches above the nasion to make sure that we have all of the frontal. Okay, and that should equal an 8 by 10 collimated field. 10 should be lengthwise, and your placement for your IR is a 10 by 12 lengthwise, by the way. Okay, and this is what this should look like. Okay, so this is a lateral sinus view. All 4 of your sinuses are going to be demonstrated. So you've got your frontal, here is your sphenoid, your maxillas, and your ethmoids. Okay, the cranium should not be rotated or tilted. You should be able to see your EAMs superimposed. Your mandibular rami should be superimposed as well, and then your orbital plates should be superimposed. Okay, and you have good exposure factors so that you can differentiate between air and fluid levels. Okay, so your lateral projections are going to show you all 4 sets of sinuses. It's going to also show you your anterior and your superior to inferior dimensions of those sinuses. It'll show you the thickness of the frontal bone. And of course, the detail is going to be better on the side closest to the image receptor. Okay, the next projection we're going to talk about is our PA axial, our Caldwell, and this is for your sinuses. Okay, so this can be a little bit confusing, but remember on your skull imaging, your PA Caldwell has a 15-degree angle down, and this image right here, this cartoon image on your slide, is for the skull imaging. Okay, and I'm just doing that as an illustration, so don't get confused. But this is for the skull, so I want you to remember how we position the patient, the forehead and the nose up against the vertical buccal, and we angled our central ray 15 degrees caudal. Okay, and remember we talked about in sinuses, we do not want to angle our central ray because that will make that air fluid line fuzzy. It'll distort it. So we don't want any angle on our central ray. So we need to resolve that issue. So we still want a Caldwell image, but we can't angle our central ray. So what do? So in this illustration, it shows that the central ray is being angled downward, cauded 15 degrees. Okay. Now what we need to do is take this line and we need to bring it horizontal, okay, so that the central ray is horizontal. In doing that, our OML is no longer going to be the horizontal. If this is coming down to be horizontal, then this OML is going to be projecting upward. So your 15-degree angle is going to be from that body part being angled 15 degrees upward, okay? Your patient's nose and forehead is still going to be on the IR. However, since that OML needs to be angled upward at a 15-degree angle now because our central ray is horizontal, okay? So try to see this in your mind's eye, how if you make that central ray horizontal, how that OML is now going to be tipped up, okay? The IR can be angled as well. So I'll show you some images of that where you can actually angle the buccal instead of your patient. However, in this image here, we're going to go with a straight central ray, horizontal central ray, and a straight vertical wall buccal. Most wall buccals don't tilt. Some do, but some don't. Okay, so we're going to show you both types. So the central ray is going to exit at the nasion here for this Caldwell sinuses. Okay, your patient's nose and forehead is going to be on the IR or on the bucky. So the way to do that is have the patient put their nose and forehead right up there against the bucky and then tilt their chin upward so that they get a 15-degree tilt on that OML. Okay, keeping your central ray horizontal and exiting your nasion. And you can see what that does when you tilt that OML upward. It's going to bring that forehead back off of the IR. So you might need to put a wedge to hold your patient steady. Okay, now this method is not preferred because it increases your object of interest, which is our sinuses, away from your IR. So it's increasing our OID, which is going to give us distortion. It's going to give us decreased resolution because we're magnifying that. So this is just another view of this. Okay, they're using a wedge to keep the patient's head still. They have a horizontal central ray exiting the nasion. The OML is tilted 15 degrees from that horizontal plane. Okay, collimation is going to be 8 by 10 again. Okay, it's going to extend 1 inch beyond the lateral skin shadows. It's going to extend superiorly to include just the top of the head, just a little teeny shadow of the top of the head. And it's going to go all the way down inferiorly to include all of that occlusal plane, just like we talked about on the lateral. And it should again be 8 by 10. Your 10 by 12 IR is lengthwise in your bucky. Now this is an illustrated view of if you have a vertical bucky device that you can tilt. Okay, you're keeping your central ray horizontal, but instead of having to put that wedge in front of your patient's forehead to keep them still, you can tilt that bucky and then you'll get better placement from the forehead and nose still touching your IR surface, as well as less distortion because now this OID issue has been resolved. So this is the preferred method. However, like I had mentioned before, most facilities do not have tilting wall buckies. If you do, consider yourself fortunate and utilize that for your sinus imaging. Okay, your MSP and your OML need to be perpendicular to the IR plane. When you're using a tilt, just make sure your OML is perpendicular, okay? And you should get it every time. Your central ray is still going to exit your nasion, okay? Collimation will be the same, 8 by 10. Okay, and what this picture is going to demonstrate is your anterior ethmoid air cells, your frontal sinuses, okay? And they're you can barely see them on this patient. Your sphenoid sinuses are going to be seen through your nasal fossa. They're below the ethmoids. Your petrous pyramids are going to be in the lower third of your orbit, and you can see them here. That's how you can tell this is a Caldwell, if you see those petrous pyramids in the lower third of your orbits, okay? Your frontal and your ethmoid sinuses are the best demonstrated in this. The petrous ridges, as I said, are in the lower third, and you're going to ensure that there's no rotation or tilt. So everything is symmetrical on both sides. Okay, now the third image, that we're going to talk about is waters. Okay, so this is your Parietoacanthial view. So parietal bones here, your occipitals down here. So these are your parietal bones. It's entering parietal and it's exiting your acanthion. So this is your waters view. And in order to remember your waters, you need to remember when you say waters, you want your chin touching your IR. So waters and chin need to go together in your mind so that you can remember this. There is a 37-degree angle that you'll remember from the horizontal. So your OML will be angled up 37 degrees from the horizontal. Okay, waters view. So your patient position should be upright, as we had mentioned before. Your MSP is going to be centered to that midline. Make sure there's no rotation or tilt. You're going to hyperextend your patient's neck to place that OML at a 37-degree angle from the IR. Now this is going to make it so that your MSP and your MML should be perpendicular, okay, perpendicular to the IR. Here's another view of that. Okay, MML is perpendicular. Your OML will be a 37-degree angle from the horizontal. Your central ray is going to enter the parietal bones and it's going to exert the canthion. And your collimation, again, is 8 by 10. And it's going to be 1 inch beyond those lateral skin shadows. It's superior to include just the top of the head, just with a little shadow, and inferior for that occlusal plane. So just like your other Caldwell, same kind of collimation. It's an 8 by 10, and your IR is placed in the bucky 10 by 12 lengthwise. Okay, so central ray and MML are perpendicular to the plane of the IR. Okay, don't forget this angle. I keep repeating it because you're going to see it on a test. The OML needs to be at a 37-degree angle from the horizontal for this waters view. Okay, that's what this is going to look like here. This is your waters sinus view. It's going to demonstrate best the maxillary sinuses, okay? The petrous pyramid should be inferior to your maxillary sinus floor, okay? You should see all of your maxillary sinuses if you've hyperextended your patient's neck enough and have that good 37-degree OML angle. The frontal and your ethmoid sinuses will be distorted, and you can know why. If you just position yourself, look at how far away your frontal and your ethmoid sinuses are away from your IR. So there's going to be magnification, which means there's going to be distortion, and when there's distortion, there's less resolution. So it's not ideal for those. This is a view for maxillary sinuses. Okay, you want to ensure that there's no rotation of the cranium. And lastly, those petrous pyramids really need to be below the maxillary sinuses for this to be diagnostic for your radiologists. Okay, this is another version of the waters, but it's the open mouth waters, because in this one we're looking for the sphenoid, okay? So it is a special projection. You don't always do this as part of your routine protocol, but if it's asked for, this is how you do this. So this is a Parietoacanthial transoral. So it's entering your parietal bones. It's going to exit at the region of the acanthion, transoral, going through the oral cavity. Okay, you're still going to have a 37-degree OML from that horizontal line. Okay. So how you get your patient into position for this, same as the waters, you're going to put your chin and the nose on the IR though, and then you're going to slowly have your patient open their mouth and hold that position. The central ray is horizontal, exiting the acanthion. Okay, this is another image of this. Now, notice in this projection, in the open mouth waters projection, remember in the regular waters projection, your MML is perpendicular. Okay, you've got that 37-degree angle going on and your MML is perpendicular. In this projection, since you've slowly had your patient open their mouth, that brought their chin down. So now your MML is no longer perpendicular to that IR plane. You need to remember that, okay? So most importantly, you're going to make sure that you position them correctly to begin with, that 37-degree OML line from the horizontal. Okay, then have them slowly open their mouth, and you need to use your x-ray eyes to show that that central ray is entering through the parietal bones, exiting in the region of the nasal spine, the acanthion, and making sure that this sphenoid sinus, which is back here posteriorly, can be projected through that open mouth. By the way, all of the breathing for these is all suspended respiration, okay? Now, once again, this is a 10 by 12 lengthwise IR, okay? Same collimation as before. The criteria, what you're going to see is that sphenoid sinus through that open mouth, okay? The frontal and the maxillary sinuses are also included. Okay, making sure there's no rotation or tilt. Your petrous ridges need to be below your maxillary sinuses. Remember, this is a water, so those petrous ridges, because you've hyperextended your patient's neck and angled their OML 37 degrees up, those petrous ridges should be below your maxillary sinuses. Okay, moving on. Our last image that we're going to look at here is our SMV for your sinuses. So with the SMV, we're going to use the IOML line. Okay, you're, as usual, going to have a horizontal central ray. It's going to enter the chin, right underneath the chin, right in the middle of both of the angles of your mandible. Right in the middle there. Your IOML is going to be parallel to the plane of your IR. You've got a horizontal central ray, and it's angled right in the middle of both these angles of your mandible. Okay, so this is another view of that. Okay, you can see the entry point. Here's the angles. It's going to be right in the middle of those angles. Your IOML parallel to the plane of the IR. Okay, it's important to make sure that you seat, if you're seating your patient, which is safer, is moving that chair about a foot or so, sometimes even more, in front of that vertical bucky, and then having them extend their head back so that the vertex of their head is resting on the IR. Okay, the MSP is going to be perpendicular to the plane of the IR. And once again, the IOML is parallel. Okay, this is another illustration of that. Okay, IOML is parallel. Your central ray enters in the middle of both of these angles. This is kind of low, but it is just an illustration. Okay, it should be entering the MSP 3/4 of an inch anterior to your EAM, and that should coincide with the angles of your mandible. Okay, collimation once again is going to be 8 by 10. It's going to extend a 1/2 to 1 inch beyond the tip of the nose and on your lateral sides, and should be no larger than an 8 by 10. As usual, your 10 by 12 is lengthwise in your bucky. And this is what your SMV sinuses are going to look like. Okay, so your mandibular condyles are going to be anterior. So here's your mandibular condyles. They're going to be anterior to your petrous ridges right here. Okay, you want to ensure there's no rotation or tilt. You're correctly collimated. Okay, 1/2 inch above the tip of the nose, which we can't even see here. Okay. And then your exposure factors, of course, are going to be optimal to see black and white between air and fluid levels. Okay, this shows your sphenoid and ethmoid sinuses. You've got an excellent view of your ethmoid sinuses here and your sphenoid sinus. It's going to show your mandible and your bony nasal septum. Okay, now we're just going to look at some images for evaluation. Okay, for the lateral projection, you're going to make sure it's collimated well. You use close beam restriction to just the sinus area. We want to see all 4 sinus groups. The sphenoidal sinus is best demonstrated. Okay, no rotation or tilt, and you can evidence that by the sella turcica is going to be in profile. Your orbital roofs are superimposed and your mandibular rami are superimposed. And this is a coned image of sinuses, which was very popular. Now you don't see that as much with CT doing most of the sinuses, but coning is very good for detail. You can see your sella turcica in profile. Your orbital bones, your orbital rims are all superimposed. Your mandibular rami should be superimposed, and you see your sphenoid sinus and your ethmoid sinuses. Here's your frontal sinus. Okay, make sure you guys know this anatomy that this is pointing out, your maxillary sinus. Okay, you'll see this picture again without the labels. Okay, for your PA axial, your Caldwell, you're going to make sure that you've collimated well. Your frontal sinuses are going to be lying above that frontonasal suture. We talked about that last week. And the anterior ethmoidal air cells lying above the petrous ridges. Okay, make sure there's no rotation or tilt. And you can tell that by equal distance between the lateral border of the skulls and the lateral border of the orbits. And I'll show that to you on the pictures. The petrous ridge is symmetric on both sides, and your MSP is aligned with that long axis of your field. Lastly, your petrous ridges will lie in the lower third of the orbits, and the brightness and contrast should be sufficient to see your air fluid levels. Okay, going back to this one. Okay, equal distance between the lateral border of the skull and lateral border of the orbits. Okay, so when we're looking here, we want to see the lateral border of the orbit and the lateral border of the skull. This distance here should be equal on both sides to ensure that there's no rotation or tilt. Okay, so if you are looking at your image and it looks very symmetrical between both sides, you've done a great job. Okay, make sure you know the anatomy where you're looking for the frontal sinuses here, your ethmoid sinuses, and your sphenoid sinus. Okay, another Caldwell, frontal sinuses. Right here, ethmoids, sphenoid. Okay, this also shows maxillary sinuses, but they're going to be obstructed by the petrous ridges. So this is not an ideal projection at all for maxillaries. Okay, remember that petrous ridge is in the lower third of the orbits on a Caldwell. Okay. Okay, waters. We're going to make sure it's collimated well. It's shown for the maxillary sinuses, so we got to make sure that those petrous ridges are below the floor of the maxillaries. Okay, that OML needs to be in proper position, so that's 37 degrees. Okay, we're going to make sure that there's no rotation or tilt just by looking at those lateral borders on both sides. Your orbits and your maxillary sinuses should be symmetrical. Okay, the MSP should be aligned with the long axis of your field. And you have good technical factors for black and white contrast. Okay, this is a waters. And so we are looking, our petrous ridges are below the maxillary floor. So that's good positioning. Okay, we see symmetrical orbits. Okay, and we have equal distance on both sides laterally. So that makes sure that we don't have any rotation or tilt. Okay. And we can see our maxillary sinuses. This one's got a lot of gunk in it compared to this one on the left. Another view of the waters. Okay, here's your frontal. Here's some ethmoids. Here's your maxillary. Okay, your petrous ridges are well below the maxillary floor. Okay, this even has your mastoid air cells here from your temporal bones. That's nice. Okay, make sure you know this anatomy. You'll see that picture again without any labels, and we're almost done here. Okay, this next one is the open mouth waters, so for our sphenoid sinus. So we're going to make sure that we have proper collimation. The sphenoid sinuses are projected through the open mouth. Okay, it's just going to show your maxillary sinuses, making sure that those petrous ridges are below the floor of the maxillaries. Your OML is in a proper position, as evidenced by the petrous pyramids lying inferior to the floor of your maxillary sinuses. Okay, we're going to make sure that we don't have any rotation or tilt. The orbits in the maxillary sinuses are symmetrical on both sides. And this shows open mouth. So we've got our maxillary sinuses here. No petrous ridges obscuring our maxillaries. This is our sphenoid sinus. There's two of them, see that? Okay, and that is shown through the open mouth. This is good, okay? So make sure you guys know your anatomy when you're looking at this image. Okay, and then lastly, the SMV projection. Okay, it's going to show your sphenoid and ethmoid sinuses. You're going to make sure you have equal distances on both sides. And you show that on your SMV portion by looking at your mandibular condyles. Okay, we're going to make sure the IOML has been positioned parallel to the IR, and you're going to know that by the superimposition of that anterior frontal bone by your chin, your mental protuberance. Insufficient extension will cause the mandible to superimpose over your ethmoid sinuses. Okay, and these are good SMVs. Okay. Frontal bone and your mentum. Okay, so we'll look at your anatomy here. You have a maxillary sinus here. This one is obscured. Your ethmoid sinuses. Okay. Here's your mandible, and here's your condyles. And if your mandible condyles and your lateral portion of your skull bone here are equal distance, that ensures you don't have any rotation or tilt. Okay, so sphenoid sinus. Okay, now we just have a couple questions. Which sinuses are indicated by this arrow? Here's your arrow, and all of you should know which one that is. Okay, and that's the frontal sinus. Then we have which sinuses are demonstrated in this projection. So this projection has our petrous pyramids in the lower third of the orbit, so that is the Caldwell, okay? And which sinuses do we use a Caldwell for? Okay, the answer is for the frontal sinuses and your anterior ethmoids right here. Now this does show your maxillary, but it's through your petrous pyramids here, so it's not ideal, and it's not an image that we would do to show maxillary sinuses. So the answer is frontal and anterior ethmoids. Okay, this projection is a modification to demonstrate and this is a Waters, this is an open mouth Waters. And why do we do an open mouth Waters? It is specifically to look at these sinuses right here, which are the sphenoidal sinuses, okay, through the open mouth. Okay, which paranasal sinuses are divided into three groups? Okay, and the answer is the ethmoid. You have anterior, middle, and posterior. The only facial bone that contains paranasal sinuses are the sphenoid, maxillaries, frontal, or ethmoid. And the answer is maxillas. They are the only facial bones that contain paranasal sinuses. Sphenoid, frontal, and ethmoid are cranial bones. And that's a test question, you guys. Which sinuses are best demonstrated on the PA axial projection, the Caldwell method? Maxillary, sphenoid, frontal, or all of them are equally demonstrated? Okay, and the answers are the frontal. So remember what is up against the IR and what you have the best picture of, and that is your frontal sinuses. Okay, and lastly, which sinus is best demonstrated on the Parietoacanthial projection or Waters projection? Which sinuses are best demonstrated on the Waters? Maxillaries, sphenoids, ethmoids, all sinuses are equally demonstrated. So remember how you position your patient. You got a chin up against the IR, okay? And why are we putting their chin up? We're trying to get their petrous pyramids inferior to something of importance. All the rest of the sinuses are back far away. There's a large OID. So what are we looking for? So the best sinuses demonstrated on a waters are your maxillaries. The whole point to get that 37-degree angle for your OML is to get the petrous pyramids below the maxillary sinuses. That's why we do this view. Your frontal and your ethmoid sinuses are distorted because of the OID. Okay, so that is it that I have for you guys today on sinus imaging. Study hard and hope you have a great day.